My name is Elizabeth Caldwell, and I have a disability. 8 years ago, I was diagnosed with a rare genetic connective tissue disorder that unleashed an avalanche of other disabling conditions, leading me to use a cane and a wheelchair to navigate life. At first, I didn't want people to know about my disability. I wanted to hold on to the life that I had before. Playing sports, chasing ambitious dreams, and spending every summer hiking through national parks with my family, determined to visit all 63. By the time of my diagnosis, we visited 50 parks. For a while, I thought that's where my journey would end, that I would never get to see the rest. But life had other plans. In college, I decided to embrace my disability and use it as a spark for change. I co-founded my university's first organization for students with disabilities, hosting 3 campus-wide awareness weeks and 4 national letter writing campaigns. I also helped break down physical barriers and adapt school policy as the first student representative on my school's Accessibility Commission. As a free clinic volunteer, I founded a mobility aid program, raising over $4,000 for free medical equipment, from glucose monitors for a patient who reminded me of myself, to an adaptive bike for a local elementary school. I helped change lives, not in spite of my disability, but because of it. Still, it wasn't easy. Symptom flares slipped between advocacy meetings, and medical tests filled the gaps between exams. But my disability wasn't just present in every success, it was actually the foundation. Between appointments, I poured thousands of hours into rare disease research, finding answers for patients like me. As a published researcher, I was invited to be a visiting scholar in the lab studying my condition. I experienced the strength of community, and the advancements made when nothing about us without us isn't just a motto, but a method. I've had the privilege to share my story, from a TEDx talk on invisible and dynamic disabilities to a Science magazine broadcast on rare disease success stories. I've been nationally recognized as a Truman Scholar for my work in public service, and I received my university's highest undergraduate award, despite first not knowing if I'd ever be able to attend. And I did it all with mobility aids decorated with stickers, each one a reminder that resilience can still be joyful. My journey has brought me to Yale, where I'm pursuing a Master's of Public Health using health policy to advance justice for the disability community. Since my diagnosis, I have hiked in 8 more national parks. The trails I take now look different. Sometimes they're shorter, sometimes they feel steeper, but they've given me a new perspective. I may move more slowly, but in doing so, I can see the gaps and cracks in the foundation I would have otherwise overlooked. That is what disability has given me. Perspective, not limitations. It's not something that you must overcome before you reach your goals. Disability is proof that innovation and achievement is possible when everyone has a seat at the table. Yes, the trail may look different, but maybe that's what makes it worth taking.